This, when I first became a resident at Rosalind Franklin, this was the workbook that they handed all the patients. They would just hand the patients this, and patients were like, okay, and then they would throw it away. They would never see it again. It has kind of the rules of the unit, and then just tons of DBT, but it's not organized. And it's tiny words, and we do have vets that have smaller, that need smaller vision. So what we did is, when I was a fourth-year medical student, I did group therapy as part of my child and adolescent. I did a lot of group therapy for teens, and we created a kind of like a Google Docs presentation. And so we took that Google presentation, took this, and with my medical student research group that I created with medical students and residents, we created this. We built my group therapy from teens, took all the DBT, added CBT, cognitive behavioral therapy, added somatic therapy. So every single session is a mindfulness at the beginning and end. We added art component for different learners. We increased the size for our vets so they could read, and actually organized it into a session. So then and every single session that I would run on the unit, because we have native spirits that are waiting to be separated from military because they couldn't handle it. So then I go through a group therapy session with them. To start with a mindfulness activity, we do a teaching activity where I have them each go around and read a section, because at first I was just doing it that I was reading to them, and then of course we have they're teenagers, they don't want that. So now what I do is I say, we're popcorning. I'm just here as a observer. I did that with Dr. Yalam's group therapy book. I read through all of his group therapy curriculum, and that's part of his training for group therapists, is to allow them to learn how to interact with others. So they then learn, and then we get to the points that are an active activity. So one activity is doing the ACEs, the adverse childhood experiences. Another thing is doing, this is a DBT, dialectical behavioral therapy. This is a front and back. So this is my personal favorite session is the one on trauma.
They're just writing for example,
where we go through how does trauma come out in the body. And then they do a front and battle mask. That's what this is. Where how they present themselves to the world on the front. And this is very dialectical behavioral therapy, what they do for PTSD. The reason I do it is because the majority of my recruits I found had a significant amount of ACEs, adverse childhood experiences. In the poster I'm going to do tomorrow, you'll see how many. Six adverse childhood experiences was the average of my inpatient meeting retreats that were on the unit. Now that I'm about to be a third-year resident, now I do this outpatient. Now, if I have a patient that comes in with sleep problems, I just turn to my insomnia, I rip it out, and then we go over in the session to do. So that's how I then have transitioned our workbook into inpatient setting to now how I continue to use it on outpatient. So, thank you. Thank you.